Welcome to part 3 of our discussion titled Advancing Hope in Childhood Cancer. If you're just joining us, catch up on our earlier episodes. Part 1, Understanding Neuroblastoma and the Care Journey, and Part 2, Designing Better Clinical Trials for Child Patients. Both are available now on our YouTube channel at youtube.com/wetrials.
Dr. Sholler, as we all know, we've been talking a lot about research, but cancer is affecting people. And let's talk about some of the human stories that you see in your practice day to day. So how has research directly impacted the daily work that you're doing at Penn State Children's Hospital? Is there a story or two from your clinic that reminds you of why this work matters every day?
Yeah, sure. There's many stories I could tell you. My favorite part of my work is seeing my patients and caring for the kids that I get to see in clinic every day. There are many stories that have impacted the trajectory of my research and my career. If I go back to one patient that I took care of over 10 years ago, a little girl named Brooke, who she had received treatment for her high-risk neuroblastoma in Texas and then at Sloan Kettering. And then after a few relapses, was recommended to go home on hospice. Her mother reached out to us, our program, and she brought her to see me. We were able to sequence her tumor on a clinical trial. Back then, we were just learning about precision medicine with our molecular tumor board. We were able to find treatment options based on the genomics of her cancer. She received different treatments with us for over 3 years during that time, coming back and forth from Texas to CS. We had 3 wonderful years she had 3 wonderful years with her family. We were so thankful to know her. She started her own foundation called Brooke's Blossoms. She wanted to give headbands to children with flowers, to little girls who are fighting cancer, to make them happy. She was an incredibly giving little girl and loved to make other people happy. Even for me, on 2 of my birthdays, she worked with Child Life to decorate the playroom. And I'm so happy to have known such a special little person. She did die of her neuroblastoma in 2015. Her parents and family still carry on Brooke's mission, and I had the opportunity to see them this weekend, which was wonderful. Because of her and the trials she participated in, kids at all of our hospitals now, that trial was successful. We showed that 70% of kids who had sequencing done were able to find treatments options and live longer. So because of that, kids at our hospitals now all have the opportunity for genomic sequencing and review by molecular tumor board as standard of care, not on a clinical trial. And while her life was short, it was full, rich of love. She impacted more people than many do in a long lifetime. So she's just an incredible story that I'd love to remember and think about Brooke.
Absolutely. Her story was short, but her legacy is long.
Mm-hmm. Absolutely. One of the other stories that impacted my career and the trajectory for many patients today is the story of Will. He is a little boy that was diagnosed at Boston Children's when he was 9 months old. He was treated for high-risk neuroblastoma, relapse, went to another institution for a trial, came back with progression, and then at about 3 years of age was recommended to go home on hospice. And I met his father at a conference, and he asked if we had options. His son was still running around and couldn't imagine that there wasn't anything more he could do. So I at that time I said, we do have a clinical trial, phase 1, that he could enroll and may give him more time, may give us more time to find other options for him. He enrolled on a phase 1 trial with us for about a year and then had another progression, another phase 1 trial for about a year, and then another progression. At that time, his father had started a foundation, Friends of Will, and they had raised the money for us to open another clinical trial with the medication DFMO. His son was, so his foundation funded this clinical trial. His son was able to enroll as the 3rd patient on the clinical trial and did well. And 2.5 years later was still doing well and we said, I think we can stop treatment. At some point, we need to stop. And so we said, let's take a break and see what happens. His tumor continued to regress, and he's actually in college today. So he's really a story that reminds us that hope matters. His father had hope that with additional trial, they would find a treatment that could help him. And we did. It was his father that funded the trial that saved his own son. And we're so thankful for that family, because it really taught us the power of DFMO, that DFMO can help children with cancer. We actually have 3 long-term survivors from that phase 1 trial that led to the phase 2 trial that led to DFMO approval, so that all children across the U.S. have access to this medication now, really because of one little boy.
Wow. Go Will. That's amazing.
Yeah. And the medication today is called I Will Finn, after Will and another little boy, Finn, who also was critical to the story of DFMO.
Wow. That's awesome.
Mm-hmm. And
you said you had one more story.
One more story.
Sure. Yeah. No, the human stories are always great to hear.
Yeah. And this is more of just a human story here at Penn State, a story of collaboration. Here at Penn State, I saw a little boy who came to see me here from Pittsburgh, who's a high-risk neuroblastoma, a little boy named Ford, who relapsed in the brain after his battle with high-risk neuroblastoma, which is generally a very poor outcome and very challenging to cure children who have relapsed to the brain with high-risk neuroblastoma. But our team here, we collaborated with the team, Dr. Modak at Memorial Sloan Kettering, and really putting our heads together, we were able to combine our recommendations to treat him with treatment directly into the spinal fluid with some chemotherapy in combination with high-dose DFMO, which is how we use our DFMO so that it's able to cross the blood-brain barrier. Putting our recommendations together, we have seen Ford become cancer-free over the last 2 years, and he is thriving and looking wonderful. And this is why all of this work matters, and is why collaboration matters. Everyone from all institutions need to work together to find solutions for the children right in front of us. And I'm so thankful to see him in my clinic every 3 months and just see how incredibly well he's doing.
Wow, that's incredible. And yeah, you hit the nail on the head with, using the term collaboration, how important, this is all played out for your patients.
Yeah.
Wonderful. Thank you for sharing those stories. Mm-hmm. It's really, really great.
If you have another fun story, there's another fun story. So another little girl that really made a huge impact in our work was a little girl called Lily May from Ireland. As we were doing our initial phase 2 trials in high-risk neuroblastoma with DFMO, we were reaching children across the U.S. There's a little girl, Lily May in Ireland, who's back then the outcomes for high-risk neuroblastoma were very poor, and her parents found out about the medication and really wanted to be able to come to the U.S. to receive this medication. But the cost to come across the world for back and forth for 2 years was excessive. And so they were both ballet dancers, and the artistic community in Ireland came together, the dancers, singers, musicians, actors, and 300 of them recorded Elton John's Tiny Dancer, because Lily May was their tiny dancer. They recorded this whole song, and then it was magical. Elton John endorsed it. And they were able to raise the funds through the sales of the song online to be able to come, have access to the medication, and help Lily May survive and thrive. And after about a year of her coming back and forth, Elton John asked to meet her. It took 3 times before she was able to fit him into her schedule, but she was so thankful to have the opportunity to meet him and thank him for his role. And it really takes a whole community to care for a child with cancer. She's doing really well today. She's 16 in high school and doing wonderfully, but it really emphasizes how much a community is important around a family fighting for cancer and to save their child.
Wow, that is really a beautiful, beautiful story.
So many stories. I love the stories.
Yeah, no kidding. Wow, that is just, touches a lot of hearts, that one for sure.
Yeah, you can listen to the recording if you on YouTube look at Lily May and Tiny Dancer. You'll see
Oh, yeah. I would
recording
encourage
all of the
everybody to go
musicians.
find that. That's fantastic. I'll definitely be looking for that after we're done. So let's talk a little bit about ways that listeners, viewers can support pediatric cancer research. What would be some things that you would say to that?
I would say get in touch with the Beach Childhood Cancer Foundation. The Beach Childhood Cancer Foundation was started by 5 parent organizations that initially was about each of their own child. So Friends of Will, Because of Ezra, Max's Ring of Fire, Melina's White Light, I Back Jack. A lot of these foundations decided it wasn't going to be only about their child. It needed to be about all children. And so they merged together. So it's a national foundation across the United States that really funds research for childhood cancer to bring these therapies to children faster, as well as supporting genomic sequencing for any of our patients that have sequencing done. If it is billed to insurance, if insurance doesn't pay for it, it's the Beach Childhood Cancer Foundation that pays for it. They're an incredible foundations of the most caring, wonderful parents and advocates. So I would encourage people to get in touch with them. They help families do fundraisers also across the U.S. So if you want to have a run, a golf outing, a lemonade stand, other things, they'll help families organize events in their own communities to make a difference for children.
Fantastic. That's good to know. And we're going to make sure that we offer the link in this, and I'll be saying the link at the end of our interview. So, and what about raising awareness for childhood cancers? How can we do that?
Yeah, I think we all know that pink is for breast cancer, and gold is the color for childhood cancer, and the gold ribbons and just ribbons and just talking about childhood cancer happens. Just making the communities aware of this, and that these children, they're in our schools, 1 in 400 kids. Raising awareness for childhood cancer, making people aware that this occurs is important. Making Congress and our government aware is really important. Writing to your senators, talking about it on social media, letting people know that funding for childhood cancer is incredibly important. Today, only 4% of the NIH funding goes to pediatric cancer because funding is dispersed by the number of patients with that disease. So while there's over 40,000 patients with prostate cancer and breast cancer, a large amount of the government funding goes there. When there's 700 kids, 350 with medulloblastoma, very little funding from the government goes to childhood cancer. And so really helping to advocate that more funding is needed in this area is really important.
Yeah. So raising the awareness, however we can do it. And there's so many different, tools for that now. So, and the fact that, this month, as we had mentioned earlier in our conversation, is Childhood Cancer Month. That's already raising awareness. But you're right. There's so many different touch points to furthering that.
Absolutely.
What about collaborating with Beat Childhood Cancer? How can people do that?
Yes. To collaborate with Beat Childhood Cancer, there are many events that people can participate in. There's events going on across the country by the Beat Childhood Cancer Foundation. And we encourage people to attend those events, help participate, help volunteer at those events so that they can continue to happen and we can continue to raise money for our kids. Collaborating and contributing by participating in clinical trials is important for all families who are fighting as well, and encouraging data sharing between centers and collaboration across hospitals and research centers across the U.S. are all just really important things to do.
Excellent. So for families that are impacted by a rare pediatric cancer, such as neuroblastoma or sarcoma, what resources or clinical trial networks would you recommend that they explore?
Yeah, there is a central database of all clinical trials. It's called clinicaltrials.gov. And that is any clinical trial that's happening in the U.S. is required to be listed there. And so on that website, while it's a little bit cumbersome, but typing in that's your type of cancer, all of the trials that are available should be there. And then at the bottom of each trial, there's a contact information. So if you want to learn more about any one of those clinical trials, there's a contact that you can contact to get more information, whether there are many organizations through the Children's Oncology Group, our Childhood Cancer Research Consortium, and many other smaller consortiums across the U.S. are doing clinical trials, and there are obviously St. Jude and centers that are Sloan Kettering that are doing their own clinical trials. There is so much happening; it's a little bit overwhelming. But also reaching out to parent advocates such as the Beat Childhood Cancer Foundation can connect you with families with your type of cancer that have walked through that journey and can help you to walk through that journey with them. Another great opportunity that is growing right now is WeTrials. This platform will have access to many different other our pediatric cancers, as well as explanations of what they are, the treatments available, the trials available. WeTrials is a great resource that not only shares the clinical trials that are available, but simplifies them in ways that families are able to understand them and kind of digest and help them to be able to make decisions in what's best for their child.
Fantastic. Yeah. I mean, anybody who's been through the process of having a cancer diagnosis and is keen to pursue clinical trials, one of the best ways to do that is through a simplified tool. So, something like WeTrials is really great for that. So I'm going to thank you for your time today, Dr. Giselle Sholler, and it's fantastic to learn more about Beat Childhood Cancer and all the work that you're doing in this consortium and giving hope to families and the collaboration that's going on between you, the medical community, and advocates and parents and these children. It's really giving people a lot of optimism, and I feel like the future is absolutely looking brighter for children with cancer. It's nice to have this time to speak with you. So to learn more about Beat Childhood Cancer, visit research.beatcc.org. And to learn more about WeTrials, visit wetrials.com. I want to thank you all for joining us.